And hey, everybody, we are here live on a Thursday afternoon as we're going to be doing more of that kind of thing. I'm Charles McFall, and over here is Thomas Cam. Go Dogs Complain.
Whatever.
Hey, we got the memo. We actually wore the exact same shirt today. And we've been talking about not wearing our uniform shirts, and then we just wear the same one.
Did.
So, hey, we're going to get doing our Facebook sharings and that kind of thing. But today, we actually have you can't see through it. We actually have a report here, an actual PCR that a family member gave to us. Kind of looking for answers, looking for what happened, what went wrong. It's so hard to get closure sometimes in a call because nobody wants to talk about anything, especially in these days of liability and lawsuits and I'll give doctors this, okay? I will. I'm filling all this into a space while you do your thing. Then I'll toss it to you and I'll do my thing. But I'll give doctors this, that doctors are very much at risk of getting sued in today's society. For the littlest things, and we never know how a jury is going to work. And sometimes I've heard cases where definitely there's been times that, from a medical standpoint, I'm sitting here even as a paramedic going, no, that doctor did everything right, and yet they either have to settle or they lose money or they lose a lawsuit because a jury, right? I mean, it just happens. So I kind of understand why doctors don't want to give answers, give closures. And, of course, then you get below doctor. Nobody's talking about anything. Nurses won't. They have to refer it up to the doc, right? We as medics are I think every company I've ever worked for, the policy is you don't talk about anything to anybody, because there's HIPAA, right? But then there's just, I don't know, you're just not allowed to. And that's always been a struggle for me. One, because I'm a talker. Two, I need closure in my life on many things, so I'd like to give closure. And three, there's so much that is harmless that would actually help a family. So, since we don't answer to those people other than HIPAA, right, and we're not going to use names, and even then, Tom, if the family member gave us this report and we're just people in the public, we weren't on the call.
All right.
We didn't run this. We could just talk about everything, couldn't we?
I think so. I mean, I don't have nothing to do with it. They gave it to us.
Yeah. So, but out of respect, it's not necessarily about the family directly and the patient or even the medics that run the call.
It's about kind of doing the right thing, so we won't.
So, and it's good to have that habit just in case we do get involved with something somewhere that we can't talk about. If we're in the habit of talking about everything, I've done that before. Someone's like,
no,
hey,
not you, Charles.
There's this thing I want to do. Don't tell anybody. And 10 minutes later, it just kind of naturally came up in conversation.
If
I'm
you
like,
want
crap.
a secret kept, don't tell Charles, I guess.
Don't tell anybody. That's
tell
not
anybody.
true. I've never told Megan she's adopted.
Well,
Yeah.
Actually, she's not the one. We just found her.
You never actually legally adopted her. You just found her on the road.
Yeah, but the government still gives us a deduction for her.
That's all that matters, right?
Yeah.
That's where it's at. So we're going to talk about that, but then we're going to play the hypotheticals. Okay, what happens if, because we don't know exactly what the family wanted, if they were complaining on the medic. And we do that a lot here on EMS Underground. We handle the legit complaints, and there are legit complaints. And we're digging through one. I should turn that off. You hear? And then. So Jeremy said they hear us out there. I was like, well.
Oh
well. So, for those of you who are watching here on Facebook, we have a class going on outside the doors, and I thought I turned that ringer off. And Jeremy, one of our guys here, is in that class, and so he just texted that they can hear us, so that's why I yelled really loudly, just to mess with them.
Just so they can hear us clearly.
Yeah, it's true.
But your voice just carries through everything, Carl.
It does. Maybe not today because I'm already set up, but maybe I should sit on that side so my voice projects towards Gigi's place.
Yeah.
That might help a little bit.
Or maybe we just have them have class in the back.
No, we make them go out and do class outside, so they have to get used to the elements. That's what we really should do. So, You know what? If we really thought ahead, their whole class would have been just watch this show live while you're sitting there doing your
Right.
exam or something. And we will talk about if someone were to complain, how we'd handle that, those kind of things. But we definitely want to break down the call and say this is the good that happens. So sometimes, that's the title of today's show. Sometimes when the call goes right, everything you do is correct. The patient, you still lose the patient, and that is never good for a family, right? The family always
Right.
wants their member to live, and from what I understand, and actually I'm gonna pull up the email here in a second after I'm done inviting everybody, is that there were definitely circumstances that went in that what we do as human beings is we put off the inevitable. We try to say, no, this is fine. I'll deal with it later. And some of that came into play. And just to kind of get this warmed up and set up, Tom, as medics on a scene, I am sure there's probably been a time in your life that you've told somebody like, yeah, no, we'll come up tomorrow. Like, no, you need to get in the car now. I'm just, God, it's such a fine line that we walk. I'm just the medic, but I think, this is what's happening. But you never want to scare the family. And that's what I always teach anyway. Is like, we were talking about it Tuesday when I gave lectures. I'm like, well, we're supposed to avoid words like this. And I was like, no. We don't lie to a patient. But when somebody, let's say they have a broken leg and they think they're going to die, well, statistically, scientifically, more than likely, they're not going to die. They're not even going to lose a pinky toe. They're just going to get a cast. So you can tell them, like, look, no, I'm telling you, I've splinted it. You feel better. Things are better. Sure, stuff can happen, but you're going to be fine. It's that reassurance. It's that, saying calm down in a very nice way, just helping somebody out. But when something's bad, we try to protect the family and the patient from that, because that anxiety doesn't help us at all. It doesn't help the patient. So we're not going, they're dying, you need to come. But there's been times you've had to tell a family, no, don't sit here and smoke a cigarette and dilly-dally. You need to come out to the hospital, right?
Yep, need to. But the thing is that people look for reasons to complain. And people are going to complain. Because people never do anything wrong, right? People are never to blame for their condition. They're not to blame for anything. They just think that, I can sit here and I can smoke cigarettes, I can eat fatty food for 20, 30, 40, 50 years and sit here and not exercise and do anything and sit here. And then the day comes whenever I have chest pain, somebody's going to be there and they're going to save my life and I'll be okay and everything will be fine. That's what they think. And then when it doesn't go that way, then they want to look at somebody to blame. Instead of saying, you know what, maybe if he stopped smoking 20 years ago, maybe if he quit drinking beer, maybe if he quit smoking pot or doing crack or doing marijuana or cocaine or
after you've had your third bypass, you still go get those
still,
barbecue ribs and fried chicken. Yep.
Yeah. We don't point the finger there. No, it's because this crew took them 3 extra minutes to get on scene. Because it took 3 minutes. All right, I'm sorry, people, but 3 minutes, that's not going to...
It's not going to offset 40 years of damage.
Exactly.
It really isn't.
And and I need the public to understand this. And I'm speaking on behalf of EMS providers who are getting abused and talked about now, because you know what? Now the thing is out there is for people to pick on other people. Let's pick on the police officers. I was just reading this thing about Starbucks. Somebody says, I don't feel safe in Starbucks because there's police officers. Well, you know what? When somebody walks up in that dang place with a gun or they start fighting, who you going to call?
Ghostbusters?
Who's going to, Ghostbusters got a long ETA because they're in New York, ain't they?
That's true.
They're not in Arizona. Who you going to call? Do you feel safe when they show up to save you? Huh? Do you? No. Well, then that's your problem. Get out of the country. Go somewhere else. I don't know what to tell you. But a police officer drinking a coffee makes you feel unsafe? Like, really?
Yeah, that's just looking for trouble.
So let's pick on the police officers. So now let's pick on EMS people because it takes them 3 or 4 more minutes to get to my house. I'm sorry, people. They did not cause the emergency. And you know what? Whenever you're driving down the road and you're going down the road and that ambulance has come up behind you and you don't pull your butt over to get out of the way, you're the problem too. Do you know how many times in my career, and what about yours, Charles?
Yeah.
You've been going down the road. People won't get out of your dang way. But then whenever it's them on the other side, what took you so long to get here? There were cars in the way.
Yeah.
The red lights and sirens, people, is not like Moses parting the Red Sea. It doesn't happen that way. We are asking for the right of way, and the ambulance can only go so fast. And we can only do so much. Matter of fact, do you realize that there are some jurisdictions that do not allow the use of lights and sirens? Jackson County for a while could not. It didn't matter. Call came out, cardiac arrest. They still did not respond, lights and sirens.
I was in Chicago last month about this time, and was driving from outside the city, just like in Atlanta. We drive from out here to downtown Atlanta. Chicago's, I think, a bigger physical city, definitely an older city with a lot more people in it, or it seems that way anyway. I know somebody's going to email us like, well, actually Atlanta has a population. It's not the point of the story. But I was driving in, so it's a good 20, 30-minute ride through downtown Chicago into the lakefront there where the Grant Park is and all that, right there on the lake. And I saw two things happen on the way in. One was we came up to an intersection, a big, weird intersection where it's not lined up in a square coming in. It's like twisted. And this fire chief, battalion chief, that kind of vehicle comes through, and they had the green light. We had the red light anyway, but no, just lights, no siren. And it's a huge intersection, like a bunch of space. I'm like, whoa, dude, you should have your siren on to ask. I mean, to let us know you're here, because you wouldn't be out running. He was only doing 5-8 miles an hour. He's going slow, safe. I was like, wow, just lights. That doesn't seem right. Maybe that's a one-off. Then later I'm going down on whatever road we're in. It's one of those kind of like I-20. And some cop comes up beside us along the exit ramp, and his lights are going. And again, no sirens. So while I'm at this festival in Chicago, there's police everywhere, and I finally went up to someone. Was like, hey, you mind if I ask you a few questions? I'm a paramedic in Georgia, and our state law, well, the state guidelines, I guess everybody can set their own laws for counties and cities and whatnot.
Yeah, but there is a state law.
There's a state that it's either on or off, right? It's lights and sirens, or it's nothing.
Right.
Right? Okay, that hadn't changed, because that's what I was taught way back when in school, and that's what I've always stuck with. And for me, that's safe. If I'm going to flip on the lights, I'm going to flip on the sirens. Using judgment, 3 a.m, rural areas of the state, people are sleeping, nobody's out, sirens aren't hurting or helping. Well, they're not helping, but they're definitely hurting. They're waking people up. Other than that, lights on, sirens on. So I asked them about it, like, yeah, there's definitely just people cried about it. They were blunt and they were honest, and I loved them for it. Is that people were crying about it, and they petitioned their alderman, and their alderman went to the city council, and essentially, unless they just absolutely have to hit the siren, they are not allowed to use a siren in that city, across the board. Ambulances, fire, police. I'm like, man, that puts you at risk. Like, yeah, well, it is what it is.
Right. Yeah.
So.
And that's just that area too.
Yeah.
In that culture, that area. But we're in a society now where people are just out there looking for something to complain about. Oh, I was wronged, and then everybody gets on the bandwagon, but nobody takes any personal responsibility for it.
Right. Right.
Why would you feel unsafe at a Starbucks with a police officer? Maybe because you're a freaking criminal and you're afraid you're going to get arrested?
No,
is that it?
Okay, I'm going to play devil's advocate. That could be part of it. I know. So here's the thing about fear, right? And it's become less of an issue. Not eradicated, but less of an issue. But there was a very public 2 years where police officers were shooting people. And it's on video, and some of it was justified and some of it wasn't. And so then the fear gets hyped up. Now what we're dealing with, some of these kids who lived, and I call them kids, I mean, I'm sure adults too, that lived there, everybody around them was like, the cops are bad, the cops are bad. And so when they see a cop, they immediately think the cops are bad, and they don't feel safe. And then we talk about, I hate using general terms like millennials, but we talk about
I don't.
Universities.
If you don't do something wrong, they're not going to bother you.
I found that to be true for the most part.
For the most part. I mean, just like anything else, there's crooked people in everything.
True.
You know what? In that Starbucks that you're going to, there's probably somebody crooked back there that would spit in your freaking drink.
Could be. Could be.
Everywhere around you, could be crooked people, people who are going to prey upon you and stuff like that. But a gaggle of police officers, because this wasn't one police officer, this was a bunch of them.
I didn't see the story that you're referring to.
It was like 4 or 5 of them before their shift went in there to get a coffee.
Then you know what? You don't feel safe? Get out.
Yeah.
It's a public space.
Right.
Get out. You know where I didn't feel safe? I was hosting trivia at the Mellow Mushroom, public space, and this guy came in with open-toed sandals, the ugliest Hawaiian shirt I ever had, and a big old holstered gun on his side. And I didn't feel safe because I'm like, if you're going to wear sandals with that shirt, you sure as hell don't know how to use that gun. I don't feel safe with you, man. But it was like, it was right. And he was sloppy. He was sloppy. That's what made me not. It wasn't that he had a gun. It's like, you are obviously a sloppy person, and you have a gun. That makes me feel unsafe. But he had every right to be there. But he had every right to be there, and he had every right to carry. And nobody said anything. I did. And I just kept on doing what I did. You know.
Nothing happened.
Nothing happened. So, but yeah,
and the same thing, and just getting back on this about, like, the EMS responders. We're getting people sending us stuff about people complaining about this and that. Look, I just want to throw it out there. You know, I will be the first one to tell a paramedic EMT that you screwed up.
Yeah, yeah.
And I'll be the first one to tell people and families that that's your problem too. And I'm sorry, there's things that we as EMS providers cannot control. We cannot control the response time. We can't. There is no service out there. And all this stuff about like AMR and even grading and National too, what National is involved in it as well. And I think Metro is involved maybe in some of it too with response times. You know, these services that people are complaining about response times. Do you actually think, people, that there's somebody sitting around saying, okay, how can I make response times longer?
No,
I don't think so.
I think some of those companies just listed off care more about keeping their bottom line.
Well, they have to, because that's how you get paid.
Yeah.
So if you as the public want better response times, you need to be going to your commissioner. You need to be going to your state representative. You need to be going to whoever represents you and demanding to give more money to the situation, to pay for it. What you're asking people is something for nothing. And that's another problem going on around this country, is everybody wants something for nothing. Like, why should I have to pay for it? Well, you use it. It's your safety net. Whenever something happens to you or your family and you call 911, you want an ambulance there in 4 minutes, well, you're going to have to pay for it. And people be like, well, I don't use the ambulance. You don't right now, but you do not know when you're going to use that ambulance.
Yeah.
And you need to be prepared, and the only way to be prepared is to properly fund the system. A few years ago, this is probably about maybe pushing 10 years ago, I'd have to look up now, about whenever the trauma bill was up. And it had to be a constitutional amendment because they were going to add $20 to your tag. $20 a year, just $20 per tag. That's it. To fund the trauma system.
Yeah.
And it had to go out for a constitutional amendment to do this.
The Georgia Constitution.
Georgia Constitutional Amendment, or maybe I could be wrong, but it was a state referendum.
It became complicated.
Yep, you got all these groups out there. Don't tax me this, don't do that. And you know what it did? It defunded the trauma system. So if you live outside Metro Atlanta, trauma systems are scarce. Trauma centers are scarce. You know what? Because you wanted to save $20, and by the way, that $20, you know, you probably spend that in one day.
Well, and here's the thing too, though. Here's the thing: how much of it was people actually railing and whining to their commissioners, legitly? You're saying, I don't want to pay $20 more for this, find another way. And how much of it was not commissioners, but congressmen and Senate, House representatives just saying, well, if we bring this to the people, it's raising a tax. And
it went through them first. See, to get to the statewide referendum, it had to go through the House and Senate.
And they're the ones who
first.
Did they shut it down, or they?
No, the people did.
So it got voted down.
It got voted down by the people.
That's where I'm catching up.
The state representatives voted it in because they had to go through the state houses to get on the ballot.
Okay.
And it got on the statewide ballot, and the people voted it down. But then I'm sitting here listening to all these complaints in DeKalb County and Dunwoody. Wow, I wonder why my response times is maybe because we don't have enough trauma centers. You know what? Whenever you go to Grady, it's packed. When you go to DeKalb Medical Center, guess what? It's packed. When you go to Atlanta Medical Center, guess what?
It's packed.
It's packed. And the ambulances are going there, and they're sitting up against the wall. All right, my folks out there that are listening, that are on an ambulance right now, tell us how long you've been sitting up against the wall waiting on a bed. And why are you waiting on a bed? Because the trauma system hasn't been funded properly. And the hospitals aren't funded properly because you people out there do not want to pay for it. But you want it for free. And you want to sit around and complain about it. And you think that the money's just going to fall out of the sky somewhere. And it's not. And until the people decide that, you know what, I'm going to pay my EMTs and paramedics in my trauma system more than I pay my hairdresser. You realize that whenever you go, you pay your hairdresser and your nail technicians and your spa people and your Starbucks and stuff more a year than you fund an EMS system.
Unfortunately, a lot of times that can be true.
Yep. But you don't complain about that. Starbucks goes up 50 cents, 75 cents on a cup of coffee. You don't bat an eye at that. You keep going. But yet they ask for $20 a year? $20 a year. Break that down. That's just a little over $1 a month.
You got some responses now.
Okay, yeah. Preach it, Tom. Hey, Destiny, it stood 3 hours at DeKalb. 3 hours. That's 3 hours. That's one ambulance not responding to calls for 3 hours. In a 3 hour period, that ambulance, if the system was funded and functioning properly, that ambulance could run 3 or 4 more calls.
Yeah.
And respond to 3 or 4 more people. Now multiply that times the 30 to 40 ambulances just in DeKalb County. Take the ones in Fulton County. Now you're up in Fulton and Cobb and in Gwinnett County. You're upwards of hundreds of ambulances, right? And people sitting there for hours waiting on
Yeah.
a bed. And whenever they're sitting there waiting on a bed, they can't respond. Can't do anything, can you?
You know, this was something that
And I'm sorry for my soapbox, y'all,
No.
but it's just hearing the complaints and people bashing EMS systems. And I'm not taking up for AMR. I'm not taking up for Grady. I could care less, honestly, about the name of the service. It's about the system. And it doesn't matter who you put in those positions. If Grady was gone tomorrow, guess what? People are going to complain about Grady. If AMR is gone tomorrow, you know what? You may be a service trying to get that DeKalb contract, but let me put you on notice. You are next.
Yeah.
You're next to be in the hot seat. If you're trying to get into Atlanta somewhere, you would be next on the hot seat too. Because you don't have the answers and you don't have the money to fund it. Nobody does. Not for what they want. Because what they want is what? A 6 minute, 7 minute response, 8 minute response time?
The last one, depends on the area, of course, but South Fulton wants a 9 minute response time. That's the one we've talked about most recently.
Yeah. Got to get more ambulances. And it's not just about ambulances. You got to get bigger emergency rooms, bigger hospitals, more beds in the hospital so that the people have places to go.
Yeah. Yeah, and that's been the big problem there. See, that was an interesting way to start things off, for sure. Man, there are no good, easy solutions. But that takes us into that whole. We are a society of complainers at this point, right? And even to the positive when people try that whole. Did you ever do that ice bucket challenge?
Yes.
Okay, and that's what I'm saying about a positive thing. Where people think, if we just get awareness, we're gonna. No, I can't remember what the numbers are now, but the numbers. I saw the numbers. I was totally against this stupid thing. Like, it's dumb. Nobody's because that thing was you were supposed to either pour ice water on you, or you donate to the Alzheimer's research.
Right.
Their donations didn't blip hardly. It didn't. It went up some, but it did not. It's not like it went. Oh, here were standard donations, and bam, it went. No, people were just doing videos, and then they did. Most people who did it didn't even know why they were doing a video. Like, oh, Tom challenged me to do this, so I'm pouring ice on myself. It got so far away from the whole point of the idea, and that's my problem with that or complaining. Neither one of those does any good.
Right.
Except when you just keep knocking on every door. You're doing everything you can. And there's something we've been looking at that we haven't fully fleshed out yet. That person is spending their money to get open records acts done. And they're filing legitimate complaints. Like, when I say legitimate, I mean, they're going through the process. I'm not saying necessarily their complaints have been proven, but they're not just getting on Facebook and going, why me? Or calling up the boss and going, your guy sucked. They're going through the process, writing things out, telling the story over and over again. That's how you get things done. You get things done by maybe sending it to us and letting us talk about it, and we can shame some people. Because sometimes we've seen with Jon Stewart, when the right people get in front of the other right people and bring them to accountability, sometimes things get done.
Yeah.
And that's a good thing. When it comes down to fear, let's talk about the realities of that situation with the police and Starbucks. I don't feel safe. Starbucks is going to go, and then they pay for the coffee just like you did. We got money. Now, I believe Starbucks as a corporation actually cares more about communities than most corporations.
Right.
Ultimately, they want to get paid. They will shut that store down if they're not getting paid. That's what they're there for. Mm-hmm. Nobody cares.
I think Starbucks corporate came up and did the right. They've been working with the police department.
That's cool. I know when I say I know. I mean, I dealt with the Conyer Starbucks with some community-based stuff I was doing many years ago, and they are very lenient on how they support causes, and they have very, very few restrictions as opposed to like Coca-Cola won't support you unless you're a straight-up 501c3, period.
Right.
So now if you're a police charity, which is that, they might work with you, and they probably do because it's good optics is what they say. It looks good, for them to do that. Mm-hmm. But Starbucks really does let you put up. You come in like, hey, I got my local band. They're going to be playing this weekend. Can I put a flyer up? Yep. They look at it, make sure there's no vulgarity or anything that's offensive. Sure, put it up. They support the communities. Police are part of the community. And I'm with you. Now, I have dealt with some bad seeds in the police side. I've dealt with a lot of bad seeds on the medic side and the fire side too. But I've had, and it's not what you think. I'm not this wild guy who has this checkered past, but I do kind of live with my mouth running, and I just don't care about some things. And Kevin, what's our friend's name? He was an EMT at Newton. He's a police officer in Jasper County.
McFall.
No, I'm McFall. Fool.
Kevin McMichael.
Kevin McMichael. So, quick story is I called it the ghetto sled. I had this old, I can't remember even the year model, this old Ford Taurus that the police had gotten in a drug raid. And I mean, they'd torn it up, and they'd found drugs stuff. They'd popped the lock on the trunk, so it's beat all the hell. Yeah. And it was beat before the cops got to it, and then they just didn't help the situation either. So it's drivable. I paid $700 for that car. It was an A to B car, and I jumped over 2 or 3 years. I put maybe another $1.5 into it to keep it running. Mm-hmm. But it was a duct tape car. Well, it drew attention everywhere I went from the police. And one night I'm coming home, and the brakes were bad, so I hit the brakes and it kind of pull. And they were getting ready to do like the license checks and whatever. So they were patrolling the area pretty heavily. And sure enough, I got pulled over. One of my taillights went out as I was driving because the wiring was loose. And McMichael comes up and he's like, "Do you know why I stopped you?" "What are you doing, man?" He recognized. I was like, "Yeah, I do know why you stopped me." And he did his job. He ran my license protocol. Just because you recognize somebody, you should tell you drive. And he did. He did his job. But I've run it. So that was a good example. Nice. He did his job. He had a reason to pull me over. Mm-hmm. My car looked shady. It came from shady people. What can I say?
You didn't have a tail light.
And I didn't have a tail light. And when I hit the brakes, it pulled. I mean, there's a little let's be safe moment, and he did it. But then, of course, I have no history with the police, documentable history with the police. So everything comes back. Off I went. Then I had one who, after he ran my license and found out everything was clean, he tried to goad me into saying or doing something to get me arrested. We deal with people like that. It happens. But what happens when there's a school shooting? What happens when there's any shooting? Where were the police? How come I don't feel safe anymore? How come I'm not protected? You can't have both. You can't say, I feel unsafe because police are here. Well, again, did you do anything wrong? Because I'm telling you, watch the YouTube videos. Now, I hate the ones that tried to goad the cops. This whole idea of, I'm not going to answer your questions. That doesn't fly. That's some BS YouTube stuff right there.
Right.
That's the law is, if they ask you a question, you have to answer. Now, there's a certain point where you can invoke your rights.
Right.
Right, and you have a right to remain silent.
You don't have to incriminate yourself.
Right, and you have a right to remain silent.
But if they ask you what your name is, you have to give it, and you have to give a fact.
And you're supposed to, even if you don't answer, if they ask you for your ID, the law is, I don't know what the age, maybe it's 16, but the law is you're supposed to have photo ID on you at all times.
All right.
You're supposed to be able to prove who you are.
Or some way to prove.
Or some way to prove who you are. Yeah. But they usually have to, especially in this day and age with lawsuits. And honestly, as much as it's tragic to me as a changing the perception of our society, it was a good thing that those couple of years happened where officers were doing horrible things and killing innocent people because we woke up. We woke up and said, okay, we need to address this. And that is a top-down issue from the get-go. Because you've worked with people that I'm sure, I don't believe you would ever see an issue with somebody and sweep it under the rug and just hope for the best. I think if you saw somebody, I had anger issues. I can't remember how. I have levels of anger in my history. So I don't know what level I was in my dealing with issues where I worked with you. But I know I had some anger issues, at least at that point when I dealt with you. If I had flown off the handle and punched a wall, what would you have done?
I'd probably pulled you in the office and say what's going on.
Some basic counseling.
And then I would have had to be stern and say, do not do that again.
Right. So what happens if I do it again?
You go home.
Or hopefully you go deeper. I know I put you on the spot.
Well,
but hopefully
you go for a moment
here's some counseling. We got to write some.
Yeah, immediately.
Immediately
You got to get out because the situation's too violent. You need to calm down before you do something stupid.
Exactly.
Before we do something we don't want to do. The whole just calm down. And most of the time, whenever you do go home, you still go home with pay.
Yeah.
At that point.
Yeah.
So you still get paid for the rest of your shift. So that'd be a good thing. And then you come in when everything is a lot calmer, usually with human resources involved, figure out, and you get an opportunity, it gives you an opportunity to come in and start the dialogue and say, hey, I'm going through this problem, I need some help. And then human resources can say, you know what, we have this right here, this is what we need to do, so.
Yeah, so you're talking about how.
But you can't ignore it.
But
you got to, because sure enough, as a person in authority, if we just ignore it, and then you go out there and you punch a patient, then they'll be coming back and saying,
how'd you not see the signs?
You're responsible because if you would have did this, and this situation would never happen. Now you're negligent in your dealings with the situation, so you have to be on there.
And that's what I'm getting at is while it was tragic and horrible, sometimes unfortunately we don't learn our lessons the easy way as a society or as an individual. And I've been in apartments where I've seen, and I'm sure because I'm too close to it, I can't think of the specific instance. And just because something got swept under the rug doesn't mean you know about it. Right. So I'm sure somebody's probably covered for me in the past. But I've worked in apartments where I've seen them go, no, this is a problem. And they swept it, or they transferred to another partner, or I was like, no, this guy's going to, but as long as he's not on my truck, that's all I can do.
Yep.
Because I'm telling you this is a problem. Police have done it, and we needed that public statement of you can't hide it anymore. We have to deal with it. And that forced departments into having policies on anger management, discipline policies on if you don't show growth and change, type of deal.
And I think today, I've gone down this rabbit hole because our title today is like when everything goes right and the patient still dies. And I think the bunny hole or whatever I was trying to go on is that just because it doesn't go right for you as a patient or the public doesn't mean that the EMS provider wasn't doing everything within their power to make it right. The EMS providers out there cannot control the traffic. They cannot control the bed count at the hospital. They have no control over how many nurses and physicians are at the hospital. They have no control over that stuff. But we have to deal with that system all the time.
Yeah. So we'll talk about the call a little bit here. So this is a call where somebody passed away, and the email setting it up is the patient was on kidney dialysis. She's about 60, and is post holidays. It was still in December, but it was post holidays, and her and her husband had been shopping all day, and she had trouble breathing. But they had even written that off as, well, you're just too full. You ate too much. You had too much to eat and drink over the holidays. With dialysis, it kind of puts you off. Actually, that is a good segue from we're talking about burying things when we see signs. People do that all the time with their health. All the time.
Oh, I'm okay.
You're on dialysis. The second you're short of breath, you should sit down. And if that doesn't solve it, you need to get somebody to look at you.
Mm-hmm.
Because, you could have eaten and drank too much. That throws your whole system out of whack.
Yep. Maybe you need to go ahead and get some fluid removed or something,
Yeah. And ultimately, they did call 911. I'm going to try to find the actual run times here. They did call 911, and the truck came. And let's see, at 24 minutes after the hour was the call. And they were en route at 27 minutes. That's a 3-minute time from when the call came in to when they set en route. So that means they processed it through dispatch. They called over the truck, sent it to the computer system. And it's well after dinner time. It's before midnight, but well after dinner time. So it's quite possible the medics had their shoes off, possibly had their uniform shirts off. I can't remember.
Maybe they were in the bathroom.
So maybe they're in the bathroom. Yeah. So it takes 3 minutes. That's a reasonable amount of time.
But that's 3 minutes from the time the call came in and the truck went en route.
Yeah.
But does it say what time that the unit was dispatched? Because there should be a time received, dispatched.
2 minutes after they were dispatched, and roughly a full minute after they were en route. So from dispatch to en route was 1 minute. Almost exactly.
From dispatch to en route, that is extremely reasonable.
Yeah.
Because more than likely, is the system counting down the seconds there or just the minutes?
It's doing both.
So it does both, okay.
Yeah, it has hours, minutes, and seconds on
Okay,
it.
so a minute to get en route is extremely reasonable. Because think about how long does it take for you to get off your sofa in the house and walk to your car and get out?
Yeah. Well, if you have kids, 3 hours apparently in my house. But yeah, but you're right.
So 1 minute is extremely reasonable.
Yeah. Now, and they were on scene from dispatch to on scene time was 9 minutes. From initial call to on scene, that makes that 11 minutes.
But how is the mileage on there? Because mileage should be on there.
It was like, it's somewhere on here. I saw it. So I had to do the math. It's roughly 9 miles. A little less than 9 miles.
So
Oh, wait, no, that's not correct. That's to the hospital. Yeah, keep talking. I'll see if I can find it.
So depending on, I mean, how many miles it was, because at best, you cannot do 60. If you're doing 60 miles an hour
in Atlanta,
you are now in a situation where you're not utilizing due regard for the safety of the public. Because I'm going to tell you this, folks. If that ambulance is going down the road in the posted speed limit, which most places are in the urban areas, is going to be 35, 40 miles an hour at the most, right?
Yeah.
If you're doing 60 miles an hour, you're not using due regard. And if you're in an accident, that person driving that ambulance goes to jail. And we're not going to put our lives, we're not going to put our family and our livelihood at risk.
Right.
We're not going to do it. I'm not going to get out there and drive an ambulance and risk harming somebody else.
Even technically speaking, and I think this typically falls on the state patrol, the highest level, but even without being in an accident, you're driving too fast, way too fast, dangerously too fast. You're operating in a dangerous manner. License signs or not, they can follow you to the scene and arrest you.
Yeah.
Because you're jeopardizing the public.
Yeah, it is imperative that you always utilize due regard. Now, the law does not put a speed limit. The law does not say you can only do this. The law does not say you can do that. It says you're supposed to use due regard. If you're not using due regard,
yeah.
then, See, Nicole says, it takes me a few minutes to respond to either a medical call or a fire call because I have 2 kids. I've got to make sure the grandparents are home so they can watch them.
She's a volunteer.
Yeah.
Mm-hmm. And that plays in. It doesn't give me it only gives me on scene mileage and then to the hospital. Yeah, absolutely. So I'll keep setting this up while we're talking about that. So that we're talking about total elapsed time from the time you hit 911 to the time somebody's walking through your door is 11 minutes. The actual, and that's not the measured response time. The response time was under, I think it was right at 9 minutes, more or less. 8.5, 9 minutes. So, the medic's there. She's alert. We'll get into the call here in a second, but basically, she's alert and oriented, but obvious distress going on. Things are happening. And they said, okay, they're not going to spend a ton of time on scene, and that's on there as well. But they get her to the truck pretty quickly, and we're gone. And then the family said, we'll see you tomorrow, basically. I guess it's an elder. Well, I mean, 60 years old for the wife. You assume the husband's a little bit older. I don't necessarily consider 60 to 70 elderly, but maybe there's extenuating circumstances of why they didn't go with her to the hospital. I don't know. But by 3 a.m., they got a call from the hospital saying that things weren't looking well and that the patient's brain had been without oxygen for 45 minutes. And as a result, she's brain dead, which, of course, is a shock to the family. It's a shock to how that went. And this was sent to us for our take on it of how the call went, what we think happens. And I don't have any record. And we have this call with the family's permission. We have this call, but we're also a public entity. However we get it, to my knowledge, however we get it, we just have it. It's not like we're guided by HIPAA or anything else on this show, but we do have permission to have this, and we're going to dig into the meat of everything here in a minute. But this is a call that went south. This is a call that immediately they recognized as a real call when they walked in. They didn't banty about on scene going, oh, let's try this, let's try that. They didn't walk her to the ambulance, which would be stupid, horribly bad. They did everything that I can see correctly. The patient crashed. They still handled that correctly for the most part. There's a little discrepancies in the documentation, but nothing that jumps out at me as, oh, you messed up. They weren't able to get her intubated. But yeah, once they got to the hospital actually got her intubated and got her back, but she'd been without oxygen for a hot minute. Now, according to the email that we got, she'd been without oxygen for 45 minutes. The medics weren't even with this patient for a total of 45 minutes. So there was a long time at the hospital as well that they were scrambling to fix this issue and try to get her back. And this is why I titled it, sometimes when things go
the
right.
arrest was witnessed by a healthcare provider.
Yeah, the paramedic.
CPR initiated by EMS. So CPR was initiated immediately.
Yeah, it was. Absolutely it was. So why don't you start back, I think it's on the front page. It kind of gives, maybe it's the second page. It gives where the medic writes it up. And it talks about
They did get a Ross because they got Ross back.
But it says, if you really dig in, it says when they arrived at hospital. You know, and according to the email and the family and the nurse's report, that it was actually longer than that. And here's the thing. While you're digging through that, I would definitely want your opinion. I know you've read over it once, so you're just digging through for things you want. Document honestly, people. There was a slight, because he does document, Ross was when we arrived at the hospital. But if you really dig into the detail of the report that they have to provide, it really wasn't. It's like, there's one thing they said, patient improved, but the patient stayed coded. That's not an improvement. You know, that's don't be afraid to say things didn't change. I did my best. They put her, before she coded, they had her on CPAP and said no improvement. You had her on high flow oxygen. Now her stats improved, but her condition did not improve. The CPAP was to try to put, I'm assuming CHF, I mean, you're on dialysis, probably have CHF, and it's probably filling up. That's my assumption as a trained medic. The techniques I see here are appropriate. You put her on oxygen. You get her on the stretcher. You get her in the back of the truck. When you get her in the back of the truck, you put CPAP on to put that pressure down. You keep documenting it was not, I mean, it was successful, but it did not improve. And then you did, somewhere in there, you did one little thing. No, it didn't improve. Don't mark that. Be bluntly honest about what you did. And according to the documentation that I can find, you didn't get ROSC at the hospital. To me, Tom, clear me up here. If I say I got ROSC is a return of spontaneous circulation, for those of you who don't know, ROSC. So if I'm going to say I got ROSC, that's before I go through those ER doors, right? After that, all right, let me just say, before I put them in the bed, if I put that patient in the bed, then it's the hospital thing. If I say I've got ROSC, that means they're on my stretcher in any moment before they got onto the bed. That's my. And as I dug through this, it took longer than that to get ROSC. You didn't get ROSC. You turned over a patient who was still being coded. Right? Because I don't find clear documentation that we did this, and then we had a vital sign of a Brady, because usually ROSC is a Brady of 40 to 60. A patient was breathing so many times. I don't have that documentation, so I don't agree. But I'm not nitpicking. I'm just saying document better.
I will say, yeah, the documentation could be a bit better, but from me reading and looking at this, just for the crew, if you're listening to this, if you recognize this, I don't see where you did anything wrong.
No, I agree.
I don't.
I agree fully.
And if you're the family out there, I'm sorry. I pray for y'all. Your thoughts, our thoughts and prayers are with you and your family for your loss. But the crew didn't do anything wrong here.
Yeah.
In my opinion, and if I was a professional witness, I would say that for them.
Yeah.
Honestly.
Yeah, I mean, I'm just looking at the timeline here, and you saw it too.
Looked like to me they were right on top of it.
Yeah, she's on dialysis 3 times a week. Yeah. Let's explain what that basically means to somebody who doesn't understand what dialysis does.
I mean, dialysis is pretty much taking over the function of your kidneys.
Yeah.
And you don't. But whenever you're on dialysis, there's a lot of complications. It does not. It takes over the functions of your kidneys, but it doesn't replace it, and it's nowhere near as efficient. And whenever somebody's on dialysis, they're subjected to infections. They're subjected to a lot of electrolyte imbalances from here, there, and everywhere. So,
yeah, they went to the closest facility. They moved fast. I mean, looking at and the time they had to put times in for all this stuff.
Yeah.
And looking at the documentation, the tripoding is when you're leaning over and using your arm, that third, your 2 legs are on the floor and your arms pushing on the chair. That's that tripod, right? And you're breaking that triangle because you can't breathe. She had crackles. She had 60% or in the 60s, or percents were in the 60s.
Right.
It should be at 94 we give oxygen, right? So that's way low. I mean, they recognized all this, did everything.
They were on top of it.
They were absolutely on top of it. It was 9.5 miles to the hospital, and they left. So that's 10 minutes. So 21 minutes. It said they departed scene at 55 after the hour, and they got to the hospital at 16 after the next hour.
Which is, I mean, that's a 10-mile ride.
10-mile ride. I think this is South Fulton, if I'm understanding the location. So they went to Noonan, Piedmont Noonan.
Right.
So that's South Fulton, I think. So you're talking about distance, traffic, and just because it's 9 miles, it's not 9 miles straight at 60 miles an hour. It's windy and around.
And road conditions, and it's at night.
Yes.
So,
yeah, it is at night. It's approaching midnight. Dude, I don't know where this is where we can't really dig in, but they got at the hospital at 16 after. It says patient transferred at 40 after. Now, you think that means they went right in? They were working it with them.
They were working it.
Yeah, they didn't leave the room until 40 after.
So they stayed there helping.
Which also tells me document a little better because you didn't get ROSC. Because if you're helping work it, you help the team get ROSC, but we don't stay in the room if they don't need help.
Right.
You stay in the room when you're working the code.
Right.
You know.
Or at least differentiate that you had turned over care.
Right.
And if you're still providing care, I would document that.
Well, they do say here, once at Piedmont, ER patient taken to a room where further attempts of resuscitation were made. But he clearly marked ROSC at the hospital in one of his documentation. I don't know. It's not wrong.
I would put in there if ROSC was obtained, if I was providing care. If I was doing CPR, if I was still assisting, I would put the ROSC in there somewhere. I'd just make sure it was differentiated from that it was at the hospital under the care of the lead would be the physician at that time, not me being the lead.
And the reason I bring that up specifically, and the reason it sticks on me so much, is that I don't believe this family has any intent to sue. That's not the impression I get from the email that was sent to us or anything. They just wanted closure. And we're going to give them a little bit more closure when we dig into this a little bit more. But if somebody were to sue, or they're definitely, what do? We pretend that we are desktop lawyers with no degrees, right? We rip these things apart because there are times when these things need to get ripped apart. And so that's how I went at this.
Right.
Well, if you were sued, let's be real, Tom. We're not going to go in front of a jury of our peers. We're going to go in front of a jury of people who don't want to be on the jury most of the time.
Right.
And they have little to no medical education.
Right.
Because typically, if you're law enforcement, firefighter, professional firefighter, and volunteer firefighters are great, but I mean, you're on the clock professional firefighter because of the demand of time, or a medic. Either the lawyer who's suing the medical professional is going to throw it out because they have certain ones they can throw out because they don't want that. They want to win type of deal. Or it's just you're going to get forgiven because your time protects the public.
Right.
And let's be honest, police are going to be skewed. They deal with criminals all the time, and court is an adversarial thing for them. So if they get on a jury, guilty. I'm just guessing. It's what I would imagine is what I would do if I was a police officer instead of a paramedic. So we're not going to go in front of a jury of our peers. We're going to go in front of a jury of people who don't understand what we do, who read the news, watch the TV shows, hear the complaints, and we're going to have a lawyer whose whole job is to defeat us. You got to be better at this.
Right.
That's how I was always taught. Right, like you got to defend.
Yeah. Don't give anybody any ammunition.
And I don't think they would get too far with that of, we got Ross, but you really didn't. I mean, it is a gray area. Be honest. Yeah. You did the good job. You really did the good job.
Yes.
You nailed it. By just coming from that point of what can a lawyer say, if they can put doubt in that jury's mind of, well, if they got this wrong, what else did they get? You want to try to avoid leaving that room.
Right.
But yeah, let's talk about these time frames, man. They were on scene. ALS assessment made patient contact. Got the blood pressure. That was successful, but the condition was unchanged. Then they put on oxygen seconds later. I mean, because he's just documenting it. Right. So as they're doing that, they're putting on oxygen. The patient was unchanged.
And I'm not familiar with their equipment, but a lot of times whenever these reports now are attached to the monitor, and if somebody works for Grady, let me know, or AMR or whoever, because you can put on you can, as they're putting them on oxygen, they hit a button on the monitor and then it automatically feeds
exactly.
It,
and that could be where some of this came in.
Be what that is.
Yeah, because I think that is what that is. Because it's just 2 seconds later oxygen, 3 seconds later CPAP. And we know from documentation they put CPAP on in the machine. So it's probably the automatic documentation, more than likely. Because his written documentation spreads it out a little bit more. But then from there, he did a 3-lead and got bradycardia. And he keeps putting patient's response unchanged because oxygen hadn't been on that long. The treatments haven't been going. They tried 2 IVs without success, unfortunately. That's kind of common in dialysis, unfortunately. Because you have, I'm going to assume the most common dialysis is the one with the ports. And she's going 3 times a week in the middle of the night. And that's the other thing. How thick is Atlanta? There's a dozen, 2 dozen, 3 dozen, maybe more dialysis clinics around Atlanta. And you got to go at 3 in the morning.
Yeah.
That means they're round-the-clock clinics because so many people need it.
Yep.
So that's also a thing. But you can't do blood pressures or IVs on the arm with the ports.
Right.
So they tried twice, couldn't get it. They ran out of space to get it. I don't know if they tried an EJ. It didn't say they tried it. And depends on the patient. I know I'd never go for an EJ if I can't see it. If for any reason, swelling.
I'm surprised they didn't do an IO, but
I think later they document an IO.
I thought they got the second attempt.
That says unsuccessful. The first one, both of them on in this order so far, it says unsuccessful.
Okay, I thought the second one was successful.
But then so this is all These are not seconds. These are minutes. Sorry. This is time. So it wasn't seconds. So, yeah, they did the assessment. A few minutes later, put on oxygen. Got her on the stretcher, everybody got her out of the house. Got her in a truck, put her on a CPAP. 3 lead, IV, second IV. Then they got another 3 lead. And this is where she crashed. They did another 3 lead because she crashed. And immediately started CPR. And suctioning. And at this point, I'm going to double check time. I think they'd already left the scene. I don't think this was in the yard, which is appropriate. Let's see. They departed the scene at 21:55. So, yeah, they tried 1 IV in the driveway and then said, let's go.
Which is appropriate.
Because you're talking about less than 10 minutes on scene. They got her out, and tried 1 IV, didn't get it. All right, let's ride.
Right.
They were on the road 5 minutes before she crashed on the way. So we said it took 9 minutes. So 5 minutes into going to the hospital, she crashed.
Right.
And CPR immediately. Oh, that's where it says improved. Let me nitpick that as a desktop lawyer, not a lawyer. You're doing CPR. Why would you put patient response improved? Can you argue improvement if you're not getting ROSC?
I guess you could. If you're getting an O2 sat, you're getting a positive response on your end-tidal CO2.
Okay.
You could argue that would be an improvement. That shows that you're doing effective CPR.
Now, I'm trying to dig into the mindset of the medic.
That's just me spitballing. Maybe that's... And you got to understand, too, a lot of times in this documentation, it's just drop-down menus, too.
True. It might... Well, and the way it's coloned is improved and successful, so they might be tied together. Yeah. I don't know. So, of course, they did some suction for the airway. And all this is still en route to the hospital. And, okay, that was the original.
But I want to point this out because this is where I do not like... where I'm not a big fan of save awards and stuff.
No, I'm not either.
Because I'm reading this documentation here, and I tell students all the time, and when I was in the field, I tell new employees and trainees and stuff this all the time, because it's always been something that stuck to me since I was in school, is that there's several rules in EMS. Rule number 1 is people die.
Yeah.
Rule number 2, we can't always change rule number 1. This crew right here did pretty much everything right. But they don't get an award. They don't get a pat on the back, I'm sure. They don't get anything. And hopefully they're listening or somebody's listening. This is your pat on the back. You did a good job. Keep it up.
Yeah.
You can't save everybody. But here
you want to call out the medic?
But here, apparently, you tried your best, and I applaud you for doing a good job there.
We really have no problems calling the medic. We're saying good things about them. We can call them out if you want to.
Yeah, let's don't.
Because that'd be a save award, and then we're hypocrites. Yeah, okay, yeah. I got you. But the last documentation.
If we did, maybe later we'll try to reach out to them and find them and ask them first before their name gets thrown, because they may not want.
Yeah, you're right. They may not want it out there. So then, as they're almost at a hospital. The medic tries to intubate twice and unsuccessful, and it's patient vomiting. There's on the first one, it's just failed, comments unsuccessful. And I read somewhere it was like basically it was a shifted airway. It was one way or the other. They could not visualize the airway very well at all. The second attempt, there was vomiting and aspiration. Well, when something's coming at you, you can't keep your face in there.
The patient was fluid overloaded. Yeah. The lungs are probably full of fluid. Whenever you lay them flat, where's the fluid going to go?
Which you have to lay them flat to intubate. There's nothing, or to do CPR. And which, it let me tell you something to the public. I always actually try to come from the stance of attacking the medicine, right? Because if the medicine stands, you stand. That's my thought process. Because I came up too much in a good old boy system of, we make excuses for people, or, we sweep things under the rug, or, we do a little bit of remediation. You and I have talked about a number of times when, I saw this person royally screw up, horribly. And then the remediation and everything is out of sight, out of mind. Mm-hmm. And so I'm left with that. Anyway, I do admittedly come at it as I'm going to attack it first. And it stood here. Now I'm going to do the human thing is the reason I said all that. The human thing is this could weigh on this medic. I know there's a number of patients I thought I should have been able to save. That should have made a difference in keeping them alive. And they just died. And it weighed on me. It wasn't like nightmares or anything. It was like, no, I know I did my job. I know they know that it did everything they could physically do, and it wasn't in the cards. Especially from the timeline where they spent another 30 minutes in the ER working with doctors. You don't have bumps in the road. You got perfect lighting. You got every tool you need. And they still took another 30 minutes to get her back.
And that shows that they cared about that patient.
Yes.
Because in reality, what obligation do we have once we get to the hospital and we put them on that hospital bed?
Yeah. Done. We don't have to. No, it's done. It's once they're on the hospital bed, which also plays into that hanging on the wall thing. Once I put them in your bed, that's your problem. Yeah. Why am I standing here with them? Anyway, that's neither here nor there. But yeah, no, we're done.
We usually, there's very few. I don't know hardly anybody in our profession that would do that. Every time I've ever seen somebody bring in a cardiac arrest, that crew has stayed there and worked it.
No, absolutely. Unless it's like every once in a while I'll get shoot out of okay, we got a specialized team. There's not enough bodies. Thank you.
Yeah, there's not enough room. But that's the
gotcha,
they
Doc.
got
I'm
it.
Good. Yep,
They've
you got
it.
Exactly.
You know? But at 11, 12 o'clock at night,
there's
probably
not really
short.
specialized. Yeah.
They're probably short and they needed the help.
Yeah.
And they stayed and helped.
So, yeah.
And then probably went and got back in their unit, cleaned it up, and ran another call.
Yeah. And the assessment, they didn't play games with the assessment either. He didn't do at this point, it was all good. No, he put in the end results of the assessment of bag valve mask. Well, we know that there were chest rise and fall when you first got there because she didn't crash till 4 minutes on route off. But you didn't play that. You just we did BVMs. They went to the worst case scenario, put themselves out there here, and it was a solid. It was a solid medical call that you could teach off of.
Right.
You're right. That's fine. And I feel bad for everybody involved. Firefighters involved, the family, especially the family. I mean, you say your wife leaves you, and she's awake and breathing, but obviously in problems. I'll see you tomorrow. Presumably, this has maybe happened in the past.
I'm sure with dialysis is probably a thing that.
Yeah.
They're probably thinking. She's going to go. She's going. They're going to do dialysis on her tonight. She'll be better. We'll go pick her up, and keep going as normal.
I know as much as I hate to say it, I know my mother-in-law went in and out of the hospital until she didn't. Saying not quite this scenario, but dialysis, other things going on. Yeah. So that's a call. Sometimes things just don't work. Even when you need them to. And hopefully if the family ever hears this or sees this, you'll understand that we broke it down. I mean, maybe I understand not everybody has the capacity to understand everything, and they obviously have this report because they gave it to us. But hopefully that helps is that they didn't dilly-dally.
Right.
They didn't. I know I've been on scene
they did what they were trying to do.
30 minutes working a code.
Well, they did what they were trained to do, what they were supposed to do.
Yeah. And it's difficult to do IVs and intubation in the back of a truck, especially
on a dialysis patient that has very little, probably IV access to begin with.
And let's be real, we don't know what this medic shape was, but I have much more difficulty intubating in the captain's seat than you do. Right. So I got a big belly, I'm tall, I got to get low. That affects it too. But yeah, he said, let's go because that was the smartest thing to do. Yeah. Well, he was hoping to not have her code too, I'm sure. Nobody ever wants that to happen. I'm sure
that they were moving with a purpose. They knew that this patient was in distress and they were trying to do what they could do. And how many times have you put a patient who has pulmonary edema on CPAP and you see a very quick turnaround?
I've actually never used CPAP, so I
really?
don't know. Yeah.
Oh, yeah. I mean, it works great.
And so that's what obviously they were hoping for, and it just didn't work at all.
It doesn't work for everything doesn't work for everybody. So.
And I want to use this never as a blaming thing. Never. I want if the family watches this, it's not a blame game, But this needs to be a lesson to everybody else who goes through this. And I hope they would stand beside me and go, please learn from this. If you're in distress, especially with a history like this, with dialysis, of any kind of cardiac, you have a cardiac history, you start having chest pains, don't mess around. Don't go, I just need to rest. Sure, if you have a history of angina, rest, do what the doctor told you to do, and give it that 30 minutes or less, and then call 911. We're telling you, run the risk of getting that grumpy medic who comes out and doesn't want to be there and makes you feel crappy versus dying.
Right.
You know, because there are definitely medics out there. I dealt with them personally.
Because who's to say if they would have called an hour earlier,
maybe CPAP would have worked.
Maybe a whole different. She may have been able to get to the hospital in time and got on dialysis.
And maybe not.
Maybe not.
Maybe not.
Rule number 1.
Yeah.
People die. Rule number 2. We can't always change rule number 1.
Yeah.
You know, that's just how the cards are. Unfortunately, I'm sorry.
And that's why.
But the stars lined up here to give this patient the best opportunity for it. And that's what we do, why we do what we do.
Yeah.
With the tools and resources that we have.
And that's why I think this set off your complaint buzzer and why it's such a harsh reaction to these complaints is we get viewed as taxis. Why are you doing anything? Just take them to the hospital. The hospital's not miracle workers either.
Right.
They have people code and die all the time. And that's the entirety of the job of ICU is to watch for that heart to stop. Mm-hmm. That's what they do. And they're running codes. We actually had somebody who might be starting class with us soon who's a tech in the ICU. I don't know exactly what they do, but they said they're on the code team. And they run 8 to 10 codes a night. A shift, rather. I think they work overnight, but it's a shift. Well, your shift's 10 to 12 hours. So on average, you're working a code every hour and 25 minutes, every hour and 30 minutes. That's a lot of code. So the hospitals aren't magic.
Right.
You know, and again, this family, to my knowledge, is not complaining. They're not bringing lawsuits. They just wanted a little closure, or maybe the person they were talking to who was doing the research just wanted an explanation of what this meant, and we're trying to give that. But the people who do want to sue, who do want to cry foul, that takes away from the legitimate complaints of when medics do wrong.
Right.
Because we have to sort through, the we being the universal we, right? At the state level, sometimes it's one person having to sort through all these complaints.
Mm-hmm.
It's a mess. Anything else you want to throw on any of this?
Oh, no. I think I had my rant for the day. Sorry, y'all.
No, it's good. It makes us, and I know I'm not in the field anymore, but I want to speak for those who are. It makes us in the field feel like somebody's speaking for us. Because I know when I was in the field and these things would happen, and my boss, not you, I think I was in your office once the whole time I was working with you. And that was an interpersonal thing, not even a complaint outside the office thing. But I've been hauled into an office for a complaint, and I went, and I did everything to save that person's life.
Right.
Or, in one case, I actually saved their life.
I was there too.
And somebody still complains. And you feel like nobody cares about me.
But
at least people feel like you care about them.
I got a Ross once from a patient, and the family complained because when we were backing out, or actually when I was backing into the driveway so that we could get to the patient, my tires went off their driveway and bent their culvert a little.
A little bit, yeah.
And they complained.
But you saved the person's life.
I saved their lives.
Yeah, no, we get that. You know, I'll be honest, man, and this still works, is if you had backed in and even ran over my mailbox, but you saved my mother-in-law's life, I'll take care of it, man. I'll bring you pizzas and everything. I'm going to rebuild that mailbox, have you come out, we'll take a picture by it, you know. Who cares? It's a culvert compared to
People want to complain.
It's weird.
What else can I get out of this? And a lot of times we'll get the complaints. We won't get a complaint until the bill arrives. So.
Yeah. And that's the other thing. Oh, man, let's talk about that for just a second. What we need to realize as paramedics, and what the public needs to realize in general, is they still have to pay for this.
Right.
It doesn't go away because she didn't make it. He's going to deal with his grief. Now he has to deal with the funeral home, which, let me tell you, that's an ordeal. Even with the nicest possible people to deal with.
You got to pay for that too, don't you?
You got to pay for that. There's so much, and it feels like, especially when you're dealing with the loss of a loved one, it's super difficult to feel like you're getting nickel and dimed to death. But you do. You feel like you're getting nickel. And then after you've put the funerals behind you and you've maybe tried to start getting back to some sort of life, you get a bill in the mail. Not from just the ambulance, from the hospital, from the specialist, whatever. Because not everybody was just part of that one team. And then it kicks in your teeth again.
Exactly.
And it's a huge bill. It's not $5 and you're done bill. It's an $80,000 bill.
Could be.
You know, I'm guessing. I mean, what would you guess? Just from the ambulance ride alone, you're talking about $6,000 to $10,000.
The ambulance ride?
Yeah.
Only? The ambulance ride's probably about
because you did
$1,500.
Oh, because they didn't do drugs. That's right. They didn't do because they couldn't get IVs.
You only get flat rate for the ambulance. So
do you?
Yeah.
Okay.
It's either
well,
BLS.
See, that's crap.
So it's a BLS. It's going to be a BLS rate
or
an
ALS.
ALS rate.
So they get the ALS
an
rate.
ACLS rate or ACLS 2 rate. ACLS 2 is a specialty transfer from one facility to another.
Okay.
Then you get the ACLS rate.
So they would get the ACLS rate. Yeah. So you're thinking $1,500.
Yeah.
But then the hospital, depending on what they do, what they ran through, let's just call it $5,000 then. Yeah, probably more. Yeah.
I'm sure.
It's just a lot. And insure, what Jonathan Jenkins tell us, insurance 40% nationwide, 40% reimbursement from insurance. That means you're getting the bill for rent. It's just.
Yep, exactly.
I just want to put this out there to people. One, everybody grieves differently. Everybody. And you can take all the time and do it how you do it. You might seem like you get over it immediately. Doesn't matter. But you don't understand. And when somebody's grieving, they're going through all of those bills, all those constant reminders. I mean, the man, going through the process of closing my mother-in-law's estate, my wife and her brother were getting ugly calls for collections, for this, for that. And like, they had to get 20-something copies of the death certificate, which is not a pleasant thing that you ever want to do. And you have to pay for every last one of those copies and then mail them out to these companies that were calling. Of course, and they want their money until they get proven. Right. Some are really nice. Okay, we get it.
Unfortunately, you got to do that.
Yeah.
I mean, because how many times have we had students come in here and say, oh, I missed because my grandma died. Okay, well, bring me an obituary.
Yeah.
And then they don't. They can't bring. I was like, okay, what's your grandma's name? Let's look it up. Let's try to find it.
Yes. And to the students who do that, this is why we get angry with you, because when it really happens, it's a huge burden for them to carry. Yep. And you're playing it because you just want them to come to class tonight.
Right. Exactly.
You know, come on. So that's gonna wrap that up. Thanks everybody for coming out and listening. We do have a podcast now.
Yay.
You go to anchor.fm/EMS Underground. Actually, I think it's, let me double check that. I think it's actually / Georgia Institute of EMS. Because I figured we put, I don't know. We can always change things later. I always should check my stuff before I tell you what it is. It is Georgia Institute of EMS. So anchor.fm/Georgia-Institute-of-EMS, because that's how links work. But I'm going to put it here on our Facebook page. We're in Spotify. I still haven't got the email about iTunes. Apparently we're not on iTunes yet. But we're on Stitcher. We're on Spotify, Radio Public, Google Podcasts, and Breaker. I'll have to look into why we're not on iTunes yet. But there is that link. So if you want the audio version, you can do that. These videos are going to YouTube as well. So that is YouTube is Georgia Institute of EMS as well, I do believe. So you can check that out. Please send us your stories. Get in contact with us. My email's been up all day.
Don't be afraid to participate.
Yeah, Charles@GAIEMS.com. You can be anonymous. You can have your voice on the show by email me. I'll just walk you through how to do that. It's fairly simple, but I'm not going to drag it out right now. You can come be on the show. You got something you want to come talk to?
We got a spot right here for you.
Right. I can't get the camera there. The microphone's too low. But we do. We have a microphone set up right here that you could. There you go. You picked it up.
You too can be on the show. Come on, join us.
One of us. Anyway. So yeah, check it out. We just launched the EMT class. We're about to kick off advanced class next week. There's still time to sign up if you want to forward your career. If you want to do more to help people. Because honestly, a basic in this call, unless you got protocols to let fire drive for you, you've got to drive. It depends on your insurance.
Become an advanced.
Yeah, and even if you don't drive, you're doing CPR, which is not a bad thing. CPR is needed, but become an advanced. Do more. Do those IVs. Yeah, so come sign up, and yeah, we'll be back next week. We're doing the show now on Thursdays, so check us out on Thursday afternoons as we do this, probably towards 3 o'clock, between 2:30 and 3 as we push. And yeah, subscribe and all that jazz, and
like and share.
Yeah. Oh yeah, I forget, like, share, do all that stuff. I got a story about that. I'll tell you in a second. But anyway, thanks for watching, and we'll be back next week.